Hello friend, this is going to be a side glide into extension. Really good for flary low back discomfort. We want to be mindful about the position we're in. We want to be mindful about where we're gliding on. And there's a couple things I want to cover here before fully dispersing the technique. One, if you have chronic low back pain, this is something you've been dealing with, take this technique with a grain of salt. If it makes your symptoms worse, omit it. We want to be able to discern pain from mild discomfort. Pain is you're doing something, you're doing the technique, it doesn't feel good. Intuitively, you're like, yeah, this doesn't feel good. And at the end of when you're doing it, you feel worse off. We don't want to be there. Stay out of the pain cave. Mild discomfort is you're doing something, it's challenging, beads of sweat are starting to form down your face, and you're like, whoa, this is really tough. But at the end of the technique, you feel relief, you feel better off, and you're like, wow, that was actually probably good for me, and you feel better. So mild discomfort, ride that line all day. That's how the body makes adaptations. But if you're in the pain cave, get out of there. That's your check engine light. That's your body telling you, whoa, back off here. We need to not be doing that. Having said that, this side glide into extension technique has been really helpful for acute flare-ups, mild flare-ups, people who have really tough situations handling low back pain, people who are in constant flexion, whether you're sitting in a chair, whether you lift a bunch of weight and you felt the back kind of give out, whatever the case might be, this is going to be a handy technique. Go where you're able to, don't ever force, don't ever fight. Going into the technique here, I'm going to have my forearm onto the wall. So you see here, I have my elbow just below my shoulder level. I'm not right up here. I'm not trying to cramp into my upper trap. I want to have my forearm connected as well as my palm connected into the wall. If I'm just standing upright, I'm just gonna take a little, maybe like a half a step away from the wall here to start off with. That's gonna give me room to go into my side glide. Now from here, I'm gonna make an L with my hand. I'm gonna place it right into my waist, right where that hip bone is. And then all I'm doing from here is I'm gonna side glide and go into extension. So I'm gonna kind of make like a reverse J, just a mild curve into extension at that end range. All I'm doing is I'm pushing to a side glide, and my hand is helping to facilitate myself into extension. So you see how I go into extension at that end range, and then I come back to start. When I sync this with the breath, I'm gonna take the breath in, and then use my hand. Use the full breath. Then come back to start as I inhale. Notice my feet are together, so I'm not coming up on the balls at all, right? I'm just nice and tall in the plank position, feet are together, shoulder is relaxed, and I'm just flowing with the breath. Make sure I'm not bucking up through the ribcage, I'm not compressing the lumbar. I'm just purely gliding through the hips, right? So it's a side glide, and then into extension at that end range. When you start this out, things might feel a little activated, and that's kind of the idea here is we're getting the body moving in multiple different directions. We're loading tissue to create adaptation, but again, we want to be mindful to discern pain from mild discomfort. If you're in mild discomfort and you're like, yeah, you know, it was a little active there, but you know, it feels pretty good, and you go about your day and you actually feel like better, you have less flare-ups, you notice that day to day things are getting better, this is probably a good movement for you, something to consider to throw into your arsenal. But again, if you're in the pain cave, you feel worse off, you've done it a couple times, you're like, yeah, I don't really like that. That's okay. You can omit this. Maybe this isn't your cup of tea. Know that you can go on each side. So you can start out, do one side, maybe you do 8, 10 reps, and you're like, okay. And then you go to the other side, you try it out, and you do 8, 10 reps, and you're like, all right. Compare and contrast. See if there's one side that was more favorable for you. What I found is that people do it on one side and they feel mild symptom improvement, and then they do it on the other side and then it comes right back or it gets worse. So this is something known as directional preference. This is the way your body likes to move. So just because we have two sides doesn't mean that we have to address two sides. There could already be an asymmetrical dysfunction, which one side is topsy-turvy and the other side's normal. So all we're doing here is, just like you go to the tire shop to get your vehicle in alignment, same idea here. We're just getting our body in alignment by addressing the one side. So maybe you just need to work on the one side, you feel symptom improvement, you continue to do it, you start making progress. This isn't a forever fix, so once you get to this motion and you stop yielding results, that means maybe your body's ready to progress onto something new. Some things to consider here, but I hope you found this helpful, and this has been your side glide into extension technique.